Welcome to the very first episode of We Care Conversations. This is a podcast, video, talk show presented by the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. I am one of your hosts. I'm Cody Ridenauer. My company, Moto Media, has worked with the Mental Health Board for over 10 years. And originally I'm from Auglaize County, but I live in Allen County now. And I am joined by my lovely co-host, Lisa Bradley.
Thank you. What kind words. Again, Lisa Bradley. I am from Lima. I am a counselor and a prevention specialist. I'm a wife and a mother and a daughter and a friend and all the things. And so I'm excited about this opportunity to have these conversations because we know how important mental health is in all of our spaces. So I am overjoyed to be a part of this conversation as well.
Awesome. Yeah. And we thought for our first episode we should really kick it off with a bang. So we brought in the person.
Yes, let's swing for the
Yeah. So with us is the Executive Director of the Mental Health and Recovery Services Board, Tammie Cologne. Yeah. Welcome, Tammie.
Thank you.
Hi, Tammie.
Hi. Good to see both of you.
Yeah. Good to be seen.
So we got a ton to talk about in our first episode. Okay. I guess first, from your perspective, why is the Mental Health Board doing this show?
Yeah, well, there's a lot of reasons, but we could start with a required mandate through law that the boards are responsible to ensure that our community is educated, aware, and familiar on the services that we have and how to access those. And while this isn't my favorite platform to communicate that information through, we do know that we have to reach all audiences, and we know where our audiences are today. And my hope is that, those who we're not reaching through the traditional sources that we have used, that this is an opportunity to be informative and along the way to be very helpful. Sometimes people just, in their own space, want to listen to the information and see how to use it, whether they need something, whether someone they love needs something. And so throughout the series, our hopes of having experts here to really speak to our community at large is the reason why the board is behind this.
Perfect. That's why we wanted to do it. As the people that put your message out there a lot, we saw, social media is a place of turmoil kind of right now, but everybody's still using it. Yeah. And podcasts can be broken down into shorter segments, so it's just people consume things different ways. So we thought this was a great way to, without just using traditional media, get some messaging out there. Yeah. So.
Absolutely. As a professional, I'm glad that we're doing this because it gives us an opportunity to share the information that needs to be shared in a very casual, easy way to digest it. We can ask questions. Hopefully, as we grow, we'll have more input from the community to hear what they want to hear about. It's not just about what we want them to know, but we want to know what they want to know. And so, as a person who loves to talk with folks, this is good for me. This is good for me.
Well, I think that is a good point, that this does give the community an opportunity to comment and respond and inform us as well. Like, hey, that was a really good section, good information, like to know more about it, and then, we can bring that to the show.
And funny enough, we already have some viewer-submitted questions that we'll save for the end, so. Yeah.
Okay, I might change my mind. We'll see. We'll see along the way.
You're in the seat. You're here.
So I think a good way to maybe kick this off is Lisa and I were kind of talking about our spaces when we were talking before the show, and just a little bit of background about each of us to kind of establish where we're coming from and how we fit in. And then I think in the end people will see a lot of similarities with things. So I guess I'll kick it off. I was born and raised in a woods in a small town of less than 1,000 in Auglaize County.
Sounds like the beginning to an epic novel.
Yeah, I know.
Yeah, right.
Well, I guess technically I was born in a hospital in Lima,
Okay,
but
well,
yeah. Very small town, graduated with about 30 kids. My background's in music, and then my partner Chad and I opened Moto Media 13 years ago. But we've really become enmeshed in the Lima community. So I like my background of, rural Auglaize County, but now I'm part of the city in Lima, and I think that helps me understand all sides of the mental health board. So.
Yeah, so my background is I am a lifetime Spartan. Yes, go Spartans. Born and raised here, educated here, went off a couple times for school or whatever, but we, my husband and I, my family, we love Lima. This is our spot. A lot of community activity that we love to be a part of. I've been a teen mom. I've been a listener. I've worked in schools for a really long time. And I think that's how I got into the mental health space, is that I recognize that in my schoolwork with kids, that in order to impact our children, I needed to take a step back and impact and find out about their families. And by learning about their families, I recognized that there's a lot more going on than just what's on the surface. And so that's really what's driven my service for 25, 30 years. And so I'm overjoyed to be able to sit and listen with folks in a communication space, or in a community space, but also as a clinician to be able to provide a really safe space to talk about what's important to them. So I'm just overjoyed in all the work that I've done, whether it be with children and families or with community, and now in the clinical space. I'm a happy person, happy person.
So I know enough to be dangerous working with the mental health board. Lisa's in it and has been in it. What's your background, Tammie? You've done a lot.
Well, I'm originally from Pennsylvania, so I went to school to High Northern University and then moved to Lima. So I've been serving the Lima community since 1989. I too am a licensed counselor, and the majority of my work has been in mental health. Now, I've done some other things. I worked for Children's Services for a stint, Big Brothers Big Sisters. I worked in a nursing home, so I have a variety of skill sets that come from each of those experiences. But ever since I was in college, I did the hotline. So when I was an operator of a behavioral health organization here in town, I literally had done just about every job other than prescribed medication. So I've done the case management, I've done the hotline, I've done the crisis work, I've done the therapy work. So I have a variety of experience in knowing what it is that people need when they come for mental health or substance use services. But I always like to say that most of us who are doing this work are doing this out of some seed that was planted in our souls or our heart when we were young. I come from a home that was disrupted from my father's addiction that took him into the criminal justice system and away from our family. And while at the time didn't recognize it was a driving force, understand many years later that it was planted. And I can't ever remember a time in my childhood that I did not want to be a counselor. I can't remember ever wanting to be anything else, simply because I just have this passion to try to serve people, and I have a real understanding. Of course, along the way, while addiction was very early in my childhood, we all have loved people that suffer from mental illness. And are still people in my life that are trying to manage recovery from addiction. So it's very personal. While I get paid, and it is my job, I would be doing this work in any way possible, whether I was doing another job or not. So I'm very blessed to be able to go to work, get paid, and then do what my heart really wants to do.
That's awesome. Yeah. I like that you brought up the Hope Line. Yeah, let's start with some services that you all provide.
Yeah, so the Hope Line has been around obviously since before my time. I think it was established again as a result of the deinstitutionalization in the 50s and 60s when we started to take people out of the hospital, and mental health boards were developed by government as a political subdivision in order to take care of those people who are out in the community who have specialized needs. And one of the requirements is that you have a 24/7 hotline. So it's been around for years. We currently in the state of Ohio have the 988, which is a national number that has recently entered Ohio. So people have a local community hotline, which is the Hope Line. And in addition to that, at any time, they can hit 988 and also speak to a licensed professional who can help them through the situation and or get them connected to more local resources. But it was an interesting experience. It's one thing to manage a person in crisis when they're in your office because you have some control over their safety and you can see the whole person, and all of those things are important to a counselor, as Lisa knows. But when you're trying to manage that over a phone and you're, unfamiliar with where they are, the weapons that they have, the opportunities they have to hurt themselves or someone else, and you're only able to manage it through what they tell you and the cadence of their voice, that was probably one of the most difficult jobs that I've ever done. And I give all the credit to those people who answer the phone and support people through a crisis with very little ammunition. I mean, it is the phone and them and the person, and they're trying to keep them alive.
Mm-hmm. Absolutely. So while we're in this space, can you talk about confidentiality in using 988 and some other spaces? I mean, we know in the office about confidentiality. We know in folks might relate to HIPAA laws and things like that, but talk about confidentiality and 988 and how we respect confidentiality in all of these different spaces.
Yeah, both 988 and the Hope Line, they're going to ask you for information, and you are entirely in control of what you offer. You can call anonymously, and that phone call remains anonymously. You can share information, and the phone call still remains anonymously. Some of the reason we ask for that data is we're trying to figure out where people are, where needs are, where information may not be, who in our community is suffering. Is there a common theme? Is there a common space? Is there a common profile? It's not to be invasive for the person's experience, but in reality, that's all the identifying and deep personal information is confidential. There is an exception to the rule. And that is, if we can locate you, and 988 does have geolocation. Now, we hope to enhance that, right? But they have some geolocation by the pinging of the phones and your cell phone number that we can get in a proximity to where you may be. But there are times if the person responding to your call believes that your life is at risk or that you are placing someone else's life at risk, that is the time when confidentiality can be broke, and they can assist help for you or for the other individuals who may be at risk. But day to day, the whole goal is to get that crisis de-escalated so that, at the end of the call we feel like nobody is at risk, and then all of that information is confidential.
Does that happen aside from just the Hope Line? Is that through sort of any services that?
988 operates the same way, 911 operates the same way, but I can't speak to any of the other services that offer 24/7. And part of that is because as a health officer and a licensed clinician, we are charged by our licensure regulations that if a person is in imminent risk, we have full responsibility to exercise whatever we can do in order to keep them safe and the people around them safe. I don't know that the general public in other community services has that same responsibility and requirement.
Gotcha. Yeah, that makes sense. That was one of our viewer submitted questions, if they're afraid to walk into an agency or anything, like, is the whole town going to know that I have an issue? And so I think that keeps some people, especially in the smaller communities, from getting some help.
Yeah. That's very sad to me because we know that it's the stigma out there that keeps people afraid that someone knows that they've gone into a mental health agency for services. Certainly if someone sees you there's no way to protect that. But I cannot assure you there are mistakes made, there are people doing the job, and people do bad things sometimes. But the system and the rules and the requirements of the service we provide should uphold confidentiality in regards to none of that information should be public.
Similar to healthcare, it should.
Yeah, exactly. That's exactly right. On the other hand, if we could see that, and what we do try to do is just offer services that are available to general public people, right? We offer support groups, grief groups, anger management groups, to try to say, nobody knows why you're here. They don't know exactly the service that you're getting here. It doesn't mean that you have a major mental illness and you're here to get medication or, on the brinks of getting inpatient care. And if we could turn it into a wellness, like, you go to a family doctor, nobody cares if you're in the parking lot, right? Because you're going there to get well and stay well. If we could just reduce that stigma to that type of thinking in our community, then more people would be prone to get help if they need it.
Absolutely. Yeah.
My thoughts go to the folks who are still in that stigma space, and through all of the lovely TV that's out there, oftentimes I've spoken with people who get what happens in real life, in real wellness settings, confused with what they see on television. What would you like our audience to know are the differences? I mean, we kind of know generally, but what pops to your mind first about folks who think that what happens on TV is or can what happens in our wellness spaces? I know, right? I know. Yep. Everybody take a breath.
That is challenging. There are spectrums at each end of all illnesses. Some of us wake up with aches and pains, but it doesn't mean we have a diagnosis of arthritis or anything else. And some people have chronic pain, and some people recover from cancer. Some people don't. We always have people on the spectrums of all illnesses, and you have them in mental illness and substance use as well. We do have people that get severely ill, and as a result of that, engage in very unaccommodating social behaviors. They exist. They've always existed. The percentage of those people are not increasing. The numbers increase because our population increases, but when you look at where the percentage of those individuals, of all the people who we manage with mental illness, it doesn't change. It's a very small percentage of people that get that sick. The majority of people are trying to just overcome a situation, overcome a symptom. They want relief from this symptom, like most of us do, or they want their family to have relief from this dysfunction that somehow has been generated in our home. And it's all able to be redirected, with the right skill set and the right thinking and training. And that's what they want. They want to get better. They don't want to get sicker. They want things to get better, and they need assistance in doing that. So the majority of people are well and trying to get more well. We're all well in this room, but some of us are exercising to be more well. Some of us are not. Some of us watch what we eat. Some of us do not.
That's a great place for a sip. Let's sip again.
Yeah.
So the majority of people are well. They're functioning, but they're hurting, or they have this issue or this trauma or this event or something going on in their life right now that they just need some skills and support to get through, and they should feel like they can ask for that so that they can be a more well person in our community. They're not that percentage on the end that you see on TV.
Yeah.
Or you hear about in the media.
Yeah. Well, and that's currently one of my beefs about TV right now, is that, first of all, what I always try to tell folks is that, we have to remember that any TV show's first goal is to stay on the air, to make money for their network, or to do whatever. And so I'm constantly reminding people that it's not always going to look like what it looks like. It's rarely going to look like what it looks like on TV. You have to experience real conversations, real opportunities for health, real opportunities for knowledge and connection for yourself and for your family. And please remember that television is for entertainment and not, we can be informative, but it's not what it's going to look like on, Help 911 or whatever the shows might be. So that's one of my big issues, and I'm thankful that you have clarified the differences between real life situations and what folks see on TV.
Yeah, I give all the credit to the people who could probably manage it, but they'll be hurting in the process. They won't be operating day to day to the best of their ability compared to those who say, look, this sucks. I'm going to go talk to somebody. I know I can get better. I know I can feel better. I know I can, perform better. And they have the courage to walk through the door and tell a stranger, their deepest, darkest secrets, who can help them just become a more healthier person, which is what we really strive to do physically, but we don't seem to put the energy into doing that mentally.
How awesome would it be if we talked about mental wellness the way we talk about physical wellness?
I know.
I'm going to run every day. I'm going to not eat the fast food joint. I'm going to, do the things. What if it's, I'm going to practice mindfulness. I'm going to journal. I'm going to say no because no is a whole therapeutic session in and of itself.
Yeah. Or I'm going to go to counseling every week, go to my appointment.
And how about my favorite? I'm going to be honest with my therapist.
That's right. I'm going to practice what they tell me to do. I mean, because that is what we're trained in. It's really hard for the general public to understand that a stranger on one side of the desk can understand you well enough to be able to provide insight and skills and things to practice and ways to retrain your mind in order for you to get better. But that's what we do. That is our profession, and people, if they want to, benefit from it.
Yeah. Help me, help you.
That's right. That's right.
Go ahead.
No, to kind of go along with sort of that stigma of taking that first step, I'm on my own journey, and I'm talking with somebody, and one of the first sessions or first things I said was like, I'm pretty good. I don't even know for sure if I need to be doing this. Like I know enough about what's going on. I know why I'm who I am mostly. And she just had a really good analogy of, if your friend breaks 3 toes, stubs their toe on this coffee table, that really hurts, and they broke 3 toes. But if you stubbed your toe and only broke 1 at the same time, it still hurts. You're still going to want to get that checked out, and you should probably do the effort of healing and getting better. It might not be as bad as that person's, but you still need help too. So I do think that's a big barrier, especially for males.
Yeah.
Like, no, I should be able to handle this. Like, I'm fine. Like, I got this. So to get into sort of that stigma, keeping people from that first step, I guess, how would you encourage them, and then kind of what agencies and services are a good first step in these 3 counties? And then I think we can probably talk about stigma within specific communities after that too.
Yeah.
But yeah.
I think in response to what you shared, and thanks for sharing that, by the way, I think most people can handle it. But we could be living better if we didn't have to handle it, but we resolved it. And that's where people get hung up. Looking at your life and saying, is there something that's interfering in me accomplishing the life that I really have in my vision that I want to have? What's getting in the way of that? And if you can identify it, then asking for help on how to resolve it. But most of us will manage, and we all come completed by experiences, some of which we don't even remember. Right? There, when we were children. But we're getting smarter in our profession, and we're hoping to educate our community to know, but those things still matter. They're still playing a role in your relationships, in how you parent, in the choices of what you use to make yourself feel better. Yep. And is it working for you to where you wanted it to be? And if it is, good for you. But even myself, I can still see the role that having an absent father plays in my life and in the relationships that I have, and having a mother who had to work and be out of the home so much of the time, and how that has structured the way I choose to parent. And it's mostly healthy, but my children might have a different opinion, right? The helicopter mom who, we couldn't get rid of because I was like time, because I didn't have that with my mother, not by her choice, but by the way in which we had to survive. And so it's It's just reevaluating. Are you where you want to be? Do you wake up feeling like this is the life that I wanted to live? And if it's not, then where are the points that you'd like to just make change or improvement on and not be ashamed that you have to do it? It doesn't mean I'm not functioning well, but there are areas in my life I'd like to do better in.
Yeah.
And in order, now I have the benefit of being surrounded by a bunch of counselors, so I don't have to walk into an office. I just pick up the phone and get the support I need, but not everybody has that. And it shouldn't be shameful to want to go in and talk to somebody in order to just get my life to the level of living that I really had envisioned for myself. Now, I can't really begin to talk about agencies until, I'm very transparent and honest with the community to say, we know we are failing in serving the demand that is walking through the front door in a timely manner. We are short on mental health professionals. We've had very significant social events happen in like the last 10 years that succeeded the number of people that are graduating in our field of practice, serving in our communities, and that also poses a problem, right? So then when you get up the courage to go, and then you're told, oh, it's going to be 4 weeks, the subliminal message sent is, it's really not that bad. You're really not that important. It can wait 4 weeks, and that discourages people. But the truth of the matter is, it's simply now just a result of a lack of professionals. That message is not what's being sent. We are diligently doing everything we can to develop and recruit and retain staff in our 3 communities. We got a lot of things working against us in these 3 counties in Ohio. And
One of them being big cities.
yeah.
Right?
Oh, for sure.
You can come from this community, have an intent to serve this community, go to college someplace else, get a taste of, a bigger city with other things going on and other things happening, and just kind of get lulled away. And I know that that's happened to a lot of our young people.
It has.
Because they have shared that with me.
Yeah.
That I was going to come back home, but it's, I have this opportunity.
Kind of nice over here.
Yeah. And I make the competitive wages in a larger city compared to what is available here in our 3 communities is another thing that we work against. But what I say to people is, it's just, you got to look at mental health care as like specialty care. If I get diagnosed with a heart condition that requires a heart specialist, I'm going to start with my primary doctor. They're going to make a referral to a specialist. I'm going to wait, right? I'm going to wait. And then I'm going to get to the specialist, and then I'm going to have to wait for the next service that I need. And it seems extremely unfair in healthcare, but it is just how it is, right? The further you go into specialty, we can give you some entry-level position support, but to get to your therapist, who's going to be the most helpful, or to a psychiatrist who, God forbid, let's talk about the shortage of those in the country, there's going to be a delay. But you have to care enough about yourself to stay persistent in getting the help that you need. And
to do the best you can in those gaps.
Yep, that delay is not sending the message to you that you're not important, that your situation isn't important, and that people don't want to help you. It's just the volume of demand is exceeding what we have available to serve in a timely fashion. So I want to say that up front.
That's totally fair. But you're also doing some things to try to beef up your personnel. And
we're doing a lot of things, and shockingly, we sort of just threw the dart at the dartboard and prayed that the investment would bring results, not really knowing, because some of the work we're doing, it's not being done anywhere else in our state. And it's producing amazing outcomes. Our local universities have really partnered with us in creating new positions that folks can get some certification and licensure early so that we can get you some help faster. We are retaining people in our community in a way we hadn't retained before. Our particular, and I'll just mention them, Ohio State University Lima Branch has literally created a community behavioral track for their social work department, which equips them that the minute they are graduating, they are not only educationally prepared, but they've had all the experiences in our community, that they're professionally prepared and having their trainings that we know are particularly important in community mental health. And with that preparation, they're staying. Because that's the other thing we've seen a lot is people would go become a social worker, they'd get out in the field, they weren't equipped, and then they just leave.
That secondary trauma is real.
Yeah, they had no idea
Get you.
that that's what they were gonna, be dealing with, because it wasn't being taught in the classroom. Because in the classroom you get taught social work in general, which crosses, cradle to grave, but not specifically enough for what community behavioral health is, because it's hard work. It's hard work. It's working with the most difficult patients in your community. That's our charge as a community mental health agency. And so that puts you in some uncomfortable situations and in uncomfortable places in the community, and they weren't equipped and they would leave. But they're coming out equipped now, and we're seeing the retention rate is increasing.
Nice.
Yeah.
That's awesome.
Super
Fantastic. So I'm going to turn the pages a bit. Heard you mention children. You know that children and students are my wheelhouse. Talk about, if you will, mental health for our students and our young children, and what do you want the community to know about what we're doing?
Well, we are doing a lot of work in the school. We just about in every school in our 3 counties, we have what we call a navigator in there. And that navigator is to support that school system and every student in it. So if there's a situation where a student is struggling with, and I'm talking about my dog died last night. Like, when our dog died, I guarantee my son was not paying attention in class, for a few days. He was hurting. And so whatever is identified as the issue, there's a person there to either just talk through it, support you through it, or to be paying attention as to whether or not we need more help. And then working with the family and the student, trying to drive them towards their to get more help. We have a lot of prevention classroom work that we pass. Our prevention agency provides to the schools around informing and developing coping skills in regards to substance use and mental health and crisis intervention. We got a bunch of students who voluntarily participate in a program called, well, it's got a new name. I don't know. It's Gatekeepers is My World.
Yep.
What the heck is the new name?
I'm still calling it Gatekeepers.
It's an acronym.
Yeah, well, doesn't work because I don't even remember it.
We're going to get it right the next time.
Yeah.
Here on.
These are students who went through training themselves to help other students.
Yeah, which is.
And there's hundreds and thousands of them that we've trained over the course of the years. And you never unlearn what you learn, right? So they're going to take that with them for the rest of their lives to be able to help people in any environment that they're in. So we're super excited about that. We have specialized programming when we've identified there's this particular need in this school building or this community. Then we tailor some group work that we offer to the schools and to the students in order to help manage through that. But I also want to say this, all this Tammie Clun, I'm one person, she's another counselor, and we may not agree, right? Because we all have an opinion on what's going on and they all count. We can take research and use it to our advantage or disadvantage, however we want, data, advantage, disadvantage. I'm a little saddened that we have so many young kids who believe that they suffer from a mental illness when really they're experiencing life just about as normal as it ever has been, right? So I try to tell people, when your child says, I have anxiety, no, you're experiencing anxiety. And in some situations, it's perfectly normal. You should be.
You should be. Absolutely.
Right? And get comfortable with it, because anxiety actually helps us overcome, situations that we're unfamiliar with or we don't feel like we have the skill to manage. But we're starting to say to kids, you have this, you have that, and we're diagnosing and we're using diseases very loosely and labeling kids, and then they're you know, they're fulfilling that self-fulfilling prophecy. And I'm just trying to come in and say, let's just teach them some coping skills and resiliency skills, and understanding that those emotional realms that you visit are there for a purpose. I mean, we're designed biologically, physiologically. Those are helpful experiences. You're allowed to be sad. You're allowed to go through moments where sadness lasts a little longer than others. You know, you just lost your grandma. You're not depressed. Right. You're sad. You're feeling depressed. That's a feeling, but the real symptom is you're sad. On the other hand, we're also trying to inform people when the symptoms get to this level, now we need to look for help. And that's a lot of responsibility to put on the general public. So I feel like I never know whether giving them all the information about what to look for is more helpful or actually more hurtful, because now we're just labeling everybody. And that's unfortunate, because people will self-fulfill the prophecy and the labels that we place upon them. And so the last thing we want to do is, you know, to tell a little 7th grader that, you know, you have anxiety and you're going to have it for the rest of your life.
I mean, if you scroll TikTok long enough, you come out of there saying, I have this, I have this. Oh, that's me. I have that. And
Yeah, you make one small connection and suddenly that is me.
yeah, so
What I like to always share with a lot of my young people is a checklist of before they start self-diagnosing. Are you hydrated? Have you exercised? Have you been outside? Have you been watching too much social media?
Yeah.
You know, so there's some things that you can do also to help these things that you're feeling. And a lot of our kids just don't have those opportunities to be outside for long periods of time, to put their phones down, because many of them do feel absolutely attached. I mean, I've seen it, I'm sure you all have seen it, that, you know, when a young person forgets their phone or has misplaced their technology, it's not always the
I don't know about the young person. I misplaced my phone the other day, about had a meltdown.
Well, we were talking about children, so but yes, absolutely, and that is
to go along with that, you know, back in my day.
Oh, here we go. You are not okay. Go ahead.
No, you come home from school, and you were done with that part of your day. You moved on to whatever was next. I mean, kids now, they're connected. Yeah, they, you know, if they're having a situation at school, that carries through the rest of the evening, sometimes into the next morning, because they can't get away from it. So it's just a big change that I've noticed.
And I'll top that. Back in your day, I'll add back in my day. You know, our plan for that was just to take the kitchen phone off the hook, but that's a whole nother pod show. But yeah, you're exactly right.
Yeah, it's good and bad, right? The good news about social media is you can get connected to people who are your support people from all over the country and all over the world. You can get informed. So it is really managing how and the purpose in which you're using that technology. And unfortunately, there's always going to be people using it inappropriately. Yeah, absolutely. And the education these days, I find, because I'm still raising a child, and at my age, trying to stay up with what he's doing on social media and protect him almost gives me anxiety every day. Now, I'm not diagnosing myself with anxiety, but every single time he gets on social media, my anxiety rises, because I'm like, I don't know who he's connecting to. I don't have that technical skill, because we didn't grow up. Right, exactly. So that is causing a lot of family conflict, as these parents are a generational gap away from the real understanding of how to protect your, you know, we used to know how to protect your kid. You didn't go to so-and-so's house. You just didn't go, right? Because we knew what was going on and you weren't going over there. We're really feeling a bit vulnerable with our young people and trying to keep them safe, because they are much more technical savvy than we are.
Yeah, and I think as parents and the grown-ups of young people, because we know families are made up of many different grown-ups and child relationships, I also feel like you almost are in competition, right? As a parent, you don't want to be the mean heavy, or you don't want to be this drag and say you can't be on such and such for such and such amount of time, but that's oftentimes exactly what is needed.
Yeah, and then kids, just like adults do, We all start measuring what we're doing in our day-to-day life compared to what we see Sally over here posting day-to-day, and I'm like, well, my life doesn't look like that. Like, what am I doing wrong as a parent? Right, you know, and
don't look like that either.
so it's really, you know, I've had to say to my son, that is about 2 seconds of their day that you just seen on there. We could take any 2 seconds of our night. We'll find 1 2-second time period in which we looked like that, and we could post it.
We'll make it look amazing. Yeah.
But we don't know what those other minutes and hours behind the scenes look like, and they don't know what ours looks like. So let's not compare ourselves to somebody else, right? But you have to have those conversations. So we do have a lot of agencies in town, and the most even more confusing to people is we have private treatment providers. But you have to figure out, does your insurance cover them? Are they in network? Are they out of network? Are they cash only? And then we have these large community behavioral health agencies who have, it's a no reject policy. That's part of the certification to become a community behavioral health agency. Is you take on the responsibility of serving the most difficult and least desirable client. And so then we've got those large monsters in our community. Now, the good thing about them is it doesn't matter what your insurance is, right? That's who the board financially supports. If you go into a community behavioral health agency, finances become irrelevant. If you go to a private provider, then they're very relevant. Now, the board does not have contracts with private providers. We contract with certified community behavioral health agencies. We do that because they've had to get certified, and they've had to demonstrate the ability to operate according to a standard that we're willing to invest our community tax dollars in for people to get served. So,
Yeah, that's a really nice breakdown. I think people don't always know, is this a mental health board type of agency? Is this a private thing? Is this legit?
Yeah.
And a lot of private ones are great, I'm sure.
They are great, but they're typically not OMOS certified. I could hang a shingle outside on my garage and start seeing patients out of the garage if I want. I can do that by my certification. I just have to get a little, business name, and that's $50, and I can do that work. I'm not being governed by anybody but my license at that point. When you're a certified community behavioral health agency, you're governed by us, the board. You're governed by OMOS, which is the State Mental Health and Addiction Services, and you're governed by a national certifying body who comes in and says that they have these services and they're operating them according to best practices, and they have all the policies that support that. And so there's a quality measure that's inherent. Now, again, it's not foolproof, right? But there's an assumption there that they have a lot of oversight in the way they do business.
Thank you so much, if I don't get the chance to say it some more, for sitting down and obviously being our first go at this. I'm overjoyed. So some of my last questions for you is, if you had a magic wand, right, and you could make Allen, Auglaize, Hardin counties better in the mental health space, what would you do? What would it be? Go for it.
I think strengthening families as individual units, really being able to get families to partake in the family work that we ask for, and there's a host of reasons for that. One, parents who are failing to establish healthy environment and relationship with their children, they know it. What they don't know is how to change it. And then we have the youth, who's also part of that experience, or multiple youths, who are trying to go and manage this very demanding world that right now isn't real friendly with one another, right? So the safety and comfort of their childhood really has to be wrapped up in the home. And parents aren't doing horrible jobs, but they know, right? I knew when I was not effectively parenting the way I needed to, and that I needed to have conversations with other people to help me do that better, right? Because as a result, my child was going to suffer from that, and then lifelong. And where we really see the outcomes of that is and labeling kids. So we have a tendency to label the kid because we get to see them in the schoolroom. We get to see them 9 months a year. Well, nobody's seeing the parent, right? So the kid gets the label for what may be a family event. Yes, going on at home. But what we know we're seeing is an increase in kids attempting to hurt themselves. That's heartbreaking, right? And they're growing in numbers. So while we've managed to reduce other very large-scale social dilemmas in our field, this one is going in the wrong direction. And it's, kids oftentimes feel isolated. They don't have anybody to support them. They don't know how to communicate their feelings. So they don't have anyone anywhere. And so being able to take that parent who knows they're struggling and give them the courage to participate in the family programming that we have available in the community, not be humiliated by it, not feel like they're failing by it, not feeling like it's of them, right? No relationship is because of one person. It's this weird thing that just starts to grow its own life along the way. You have a very challenging toddler, right, to a ill-equipped, I'll say, parent, which was myself. I didn't have siblings. I never babysat. So when I had my first kid, I was like, what in the world is happening right now? Being able to reach out and get support and guidance from other people and really get our homes healthy. Because you get the home healthy, you get kids healthier who are going to be healthier adults down the road. We get communities that are healthier as a whole. But so it's really family structured work. I can't change what's going on in the community at large right now. We have, a lot of diversity in political opinions, in our philosophies on things, and
socioeconomic statuses.
Yeah, and they're not being kind to one another in those different opinions. So it's very hostile. Right? I can't remember living the way I live now where based on where I go and who's there guides what topics can come up and be discussed between us. Like, I don't ever remember that. When I was a young person, you could talk about anything. You'd hear opposition at the kitchen table and, life just went on. But now I'm like, okay, we're going here. And when we go here, we don't talk about these subjects because if we do, it's just going to be hostile, right? So they're not going to get what they need outside in the world today because it's just too much conflict. So it's healing homes. If I had my magic wand, it would be just to take every single household in this community, come in, what do you need from us? What can we help you so that your home is safer for all of you, healthier for all of you, and then we're going to change the trajectory of those young people who are coming out, victims to whatever they have been going on in this community. I can't fight the drug lords that are bringing drugs into our country. That's a bigger fight beyond me. We know we've got a significant amount of people using substances in our community, and we want to be able to help them. And most of them want help. They don't want to continue to have to use substances. It's just the stigma of asking for the help, the fear of I'm a parent, and I'm going to tell someone that I'm using, illegal substances, which means I'm engaging in illegal behavior, and I've got kids, and I love them, and I'm taking care of them. I don't want them to be taken from me.
But by mentioning that out loud, you are opening up a flood of challenges, new challenges.
Right. So all these consequences also prevent people from getting help. So I'd like to just creep into every house and say, what's going on? And how can we help you very quietly and, without a lot of public notice and get you as healthy as we can and go to the next household and the next household. If I had a magic wand, that's what I'd be doing.
I accept. Thank you. Thank you. Thank you.
Yeah. Oh, I think we were going to ask Tammie about more of your story a little bit.
My story?
Yeah. They were just, and then also like any stories that you have along the way of maybe where your thinking was changed or some successes or wins or,
I can definitely tell you where my thinking was changed, particularly around substance use, right? I came with a fairly hopeless perspective of people recovering. and being able to lead successful lives, because our family never was able to fully recover from my father's substance use. But I have seen the most amazing stories. And I have seen people, they ride the trike, 3 or 4 years in recovery, and then they have a relapse and they hit rock bottom, and you're like, oh my God, see, that fulfilled what my original belief system was. But they get back up. And I've seen some people go up and never go down. And so I have a tremendous amount of hope that people can recover from substance use when they're ready, with the right supports, and with the right treatment. I think one of the pivotal moments in my career was, we used to be trained, you had to set boundaries, families had to say no, you basically had to remove yourself from them. Yeah, tough love, right? And we've really recognized that was dreadful advice to family members. And you can't ask a mom not to love her child regardless of what they're doing. You can't ask a family to not allow their loved one in their home when they're homeless and they're hungry or it's Christmas. They're going to do all those things. What you do is you equip the family on how to continue to love and support your person regardless of their individual behavior, but also protecting yourself, and your home, right? There are ways you can do that all at the same time. And because the guilt that I've seen, this is pivotal moments for me, that I've seen family members have to live with as a result of that hard no, and then they get that bad phone call. It's dreadful. It's painful. They're going to live with that forever. This person's relieved of the suffering. The family is living with it for a lifetime now. So it's really, I hate to be the Pollyannas here, but, love is extremely powerful.
Love is the key.
Love is the key. So we teach a lot of people, you don't have to be angry anymore. These are their choices. Nobody's blaming you. Remember when we used to blame parents, right? If kids were using substances, well, as a parent flaw. No, none of that is true, right? So I think pivotal moments for me is when I've seen people recover and live amazingly healthy lives and produce next generations of healthy lives. And I'm like, okay, we're going to keep doing this work. I remember the day I went into my leadership team, and we used to have a rule. If you tried substance use treatment for so many times and didn't succeed, then you had to go into this other trajectory. Yeah. And I remember when I came in and said, they can come back 77 times for all I care. And every single time, they're going to get everything we have, and we're going to throw it at them like it's the first time, and we're going to believe that this time is going to work like we did the first time. And my staff will tell you that story because they just looked at me. Because it was a whole philosophical change, but it was driven out of personal experience, out of my own personal experience having a family member who was battling recovery and was being treated that way out in the world. And he had all the collateral he needed in order to accomplish recovery. Somebody just had to keep with him until he made that moment of choice. And so I've said to them, we don't choose when it is for people. We provide a service, we get paid to do a job, we're going to do it, and this is the way we're going to do it every single day. And that was very powerful.
So I heard you just mentioned 77 times, or 70 times 7. Yeah. Speak about the importance of faith in all of this work, if you would.
Yeah, I will. And again, when we talk faith, that's personal choice on where they place a higher purpose other than just getting up every morning and going to work and, collecting a paycheck and doing the things that we do in this world. But do we have a higher purpose? And so whichever way in which they establish that there is a higher purpose, and there always is for every one of us, and mostly because we interface with one another. So we're not living in a bubble. But I have seen people who have a strong faith really be able to enter recovery and stay there with less relapse and less guilt and less self-defamation, right? Because they learn to forgive themselves and to really accept that they have a role in a larger area in this world than just their little home. And it seems to motivate them, brings them hope, gives them forward thinking rather than backward thinking about all that I did, all that I didn't do. You know, they're looking this way, where we have a lot of people that struggle in recovery because either the people around them or themselves are pulling them backwards.
And constantly reminding what's back there.
Yeah.
Remember when you did, yeah.
But when you have a faith of something bigger, it puts your vision forward. And so I always encourage people, find some greater purpose than yourself. And, you know, some people it's just, you know, children. Some people it's, you know, a higher power that operates beyond the human experience. But whatever it is, step outside of yourself so that you can keep looking forward and leave it behind. You can't change the past, so there's no point in staying there. Let's go that way.
Yeah, I think it's really important for a lot of people, regardless of which faith it is.
Yeah. Well, and I think our faith communities are slowly getting on board, right? We have a lot of them that say, you know, you're the individual that church was made for, right? Because we are the space that accepts you and loves you regardless of what's behind you. But we still have individuals that make up those churches that have to make it an environment that's welcoming and embracing to the person who they may have, you know, a thought about. I mean, I still deal with people who think people that are using drugs, they're doing it on purpose. They can just stop, you know, and I can't change their thinking, but that thinking isn't helpful. Right. If that thinking was helpful in any way, shape, or form, if it was motivating people to change and get into recovery, right, we would see a world of recovery. Yeah. It's not helpful. You can have that belief system, but it's not helping. And so, you know, really challenging ourselves to not judge, to accept people as they are. That doesn't mean we put ourselves at risk. It doesn't mean we dismiss the way our parents raised us. You know, I get that a lot around certain issues. You know, well, I was raised to believe this. Well, first of all, in the time that you were raised, it was way more socially appropriate, right? But at the bottom, most of us are raised to be kind and love people. And you can have your belief system, but you can't project it out onto others, right? Because then we can't help those that we're projecting it onto. So, yeah, faith is, I find it very valuable. It is included in most recovery programs, and with mental health too.
Yeah,
right?
We know the science behind having a relationship of a higher power is absolutely inducive to healing, to recovery, to forgiveness. Yeah. Thank you for mentioning. Thank you for adding your thoughts about faith, because it's very important in many spaces. So
I mean, you know, even with mental health, there are some people that are not going to get better, and I know the world doesn't like to hear that, but it's like any other chronic disease. They can live healthier, they can live a better life, but their condition, no medication on earth that we have right now is going to eliminate that symptom that you have if we don't manage it, right? We're not going to heal you. It's not possible medically for some people who have chronic mental health conditions. But you're still a very valuable human being with that condition. We don't tell people who have diabetes you're no longer valuable in this world, right? And we don't want to send that message to people with mental illness or substance use either. Use all the resources you can to live the best life that you can, because you're important. And yeah.
Thank you.
Yeah, you're welcome.
Well, I think to kind of wrap things up, we'll do, you know, if people are looking for more information about the board, services, agencies, things like that, what are some ways they can find that info and learn more about the Mental Health Board?
Yeah, well, this will drive you, I'm sure, to our website. And, our website is about the board, because what people don't understand about Ohio, which is actually a gift that we have here in Ohio, is that we're very locally governed, right? We have commissioners and mayors. Not every state operates in the way Ohio does. And you have county health authorities. So we got the health department, and you got a community behavioral health agency who's got a legal obligation to consistently evaluate their community and develop services that will help their community get healthier. And, we operate with state and federal funds, but we also, half of our budget is our local levy. That's community's money. You should know where your money's going. You should know and hold the organization, which is myself, accountable to how we're spending that money. And so going to our website will give you all of that information about the board and the value of it, and getting to know how to use it in your community. But it will also direct you to resources, agencies, inform you of events that are going on. We have a Notify app, and you're going to have to put all that information on there.
We'll put it on the screen.
That I encourage every single human being in the county to sign up for. We developed it for people who are using substances, because I get so much information about when there's bad drugs on the street, when there's an interdiction on the street, and we're going to have a shortage of drugs, and what people are going to experience as a result of that, the high overdoses that show up in the emergency room. But how do I get that to the public so they can take care of themselves? So we've created this Notify app where it's a one-way communication. So we're not going to have conversations with you, but if you sign up, we're going to let you know. Hey, we've seen a surge of overdose. There's been identification of bad drugs on the street. Just so everybody knows, if you got a loved one that uses, you can inform them. If the user signed up, they know.
I appreciate that you can choose what you want to get notified about.
Yep.
That's very
We're sending
valuable.
out health notifications, mental health. We send out actually even articles that just, you can download it if you want to. You can ignore the text if you want to. That just talks about things to educate and inform people. But it's our way, the board's way, of trying to get the information directly to the people. We're not trying to filter it on a billboard or filter it through agencies. It's from me to you. You know everything I know. And hopefully, more informed together, we can make a difference,
And I would say the app is pretty cool, because I just get a text and I read it. I'm like, oh, that's happening.
Oh, yeah.
You can acknowledge it and move on.
Yeah.
You don't have to do anything. You don't have to interact with anybody. That's good stuff. Finally, if folks want to be involved, right? They've listened to the conversation. They're intrigued. They're interested. They're motivated to do something, to get involved.
Yeah.
What's the information for them?
So I'm sure my email is on the website, because just to share with the community, we're a 7-man show at the board. So it's not this large staff where I would send you to someone. Email me, because there's so many ways I'd want to talk to you about, how do you want to help? And so I can help identify the best way in which you could help, and also at the same time take care of you, because sometimes people want to help out of their own pain. But if you're not healthy enough,
You got to be ready.
then it causes more pain, right? So emailing really anybody at the board, and they're all on the website, we'll get you connected, because we need more soldiers than most. I mean, we're taking care of every single life. So we're not a specialized service. We don't have just pupils in school, or we don't have people that are, suffer from DD, or we don't have just the aging population. We're every single life, from cradle to grave, because mental health and substance use covers that entire spectrum. So it's a lot of people that we're trying to take care of, and the more people that help us, then the healthier our community will be.
Perfect. Thanks for watching, listening, however you're checking us out. We Care Conversations. This was episode number 1. We'll see you next time.